going to talk about interchange management, and I'm going to hand back over to you now, Ellie. If you could just kindly discuss and let us know what is interchange management.
So interchange management, or as our teams often refer to it as ICM, is the spine and the clinical systems interchange the data by interchanges. Within these interchanges, there are messages or transactions that contain all the updates that you send us or apply to either of the systems. The purpose of the system is to align PDS and the clinical system. Any issues with the data contained within interchanges or should be interchanges, such as when the data says it's missing, will result in the errors being reported to PCSE. We'll then work through those errors and determine the cause of the issue. When the root cause is identified as being related to a data being received from a clinical system, PCSE will contact the practice by email and work to resolve the issue. Issues with interchanges can be quite often very complex and therefore might require system supplier involvement. So it's good to have a good contact with them. When an interchange is sent from the spine to the GP practice clinical system, provided this is received and processed, a receipt report is sent to confirm the receipt. Those receipts are as important as the data being sent. It ensures that it's got a loop all the way through.
Thanks, Ellie. Would you be able to just discuss the importance of ICM then?
So as I just said, that there is a loop to ensure that all the data is completed and make sure it's all contained within the system. This is due to keeping the clinical system aligned and with the spine and ensuring that you have an audit trail, because that's really important to have to ensure the data was received correctly on our system and on your system. So as discussed earlier, if there's any misalignment between the systems, it could clinically impact your patients and have financial impact. So it's very important it's corrected. Practice should actively monitor their clinical systems to ensure that approvals to new registration, deduction and amendments are being received. If not, this may indicate there is an issue with the interchanges and we need to be notified to help correct it.
Okay, is there anything that we need from practices then?
So in order to ensure that it's resolved, we need your timely response. We need you to respond as quickly. If we've raised something to you or you identify something, we need to sort that out straight away. So there is an email address that we would require you to email in, pcsc.registrationspreston. We'll talk about that later for these contacts. But also, if you are moving clinical system suppliers, issues don't occur when we do that. So we need to know exactly what system supplier you're changing. There's a form that you need to complete. We need as much information contained in that form and to give us as much notice so we can ensure that we are supporting you fully through that transition.